Yeah.
Yep, drape into the top of the undies there. Okay, make sure we've got the side of the hip exposed for this massage, so the greatest you can is here. I want to sit in there. Okay, I will be moving around through here, so just see the best viewpoint you can. And I only want to get to mid and lower back, so the fact that she's got a bra on there, I'll just tuck up into that. Otherwise, we'll just have the towel sitting up here, expose as much of the back. Now, you see we've got the whole back there. We'd always keep that belly covered up, keep that nice and warm if we don't need it exposed. Okay, it's a very pregnant body, but
Which is the best for me to stand at the top there or down here?
Probably standing up here. So scoot through again. And first point. Should be the draping.
Side, yeah, side leg draping, bottom towel, perpendicular to...
Last page. You turn it over.
Oh.
Start at the start. Down here, flat hand, yeah.
Flat hand effleurage, broadening and compressions to ES and QL.
Okay. So we've got ES and QL. We can work up, but if we work a lot up, we're going to actually increase the lower back arch, so we'll come through the other way and try and flatten that back out as much as we can. Okay, so a lot of nice flat hand work. If they are, when they are pregnant, you often have a lot more back to work on because the belly will expand, the sides will expand a bit, so you've got a lot more area. So you just got to imagine I've got a larger surface area to work on. Now if we have a nice skinny girl that's pregnant, we may not have that much back. Okay, so if we do, we can actually get both hands in and do some really nice big broadening work. Okay. You don't have to worry about hands resting on the sides at all. That's perfectly fine unless they're uncomfortable with it. And you generally work all that out before you start massaging. Okay, you want to do broadening work, lengthening work along either side. I'll generally work the side that's worst first. But if I've got to work both sides because they've got a fair bit of sciatica, then I'll roll them over halfway through, do the back from both sides. Okay, you can do it in trigger point work or anything from here, working on both sides, if you don't want to roll them over. Okay, so make it nice and easy for yourself. But just a lot of nice flat hand work there, trying to lengthen out that lower back. And through that, try and find out if they've got any nasty tight spots, so we can do a little bit of FRRs working away from the spine. How's that feeling? Okay. And she's a bit tight through the lower back there. I've got a nice little trigger point sitting in there, yes. A bit tender. Talking the next point.
Okay, thumb frictions along ES and from spine across ES into QL.
Yeah. So along ES with our thumb frictions, working down towards the lower back. You see that?
Yeah.
So down the edge of QL there. It's really nice and tight. Excellent. And working down. And yes, I'll just show you on the one side. If you did need to work on the other side, you can get lower and work through here. It's best if you want to do deep work, stay on the near side. Okay? We can do some work working away as long as we don't do too much work pushing forward. So swap the hands out and work across QL. Alright, I have got this bed lower than I would normally have it, just to show you guys if you don't have your bed set up. Have the electric table, have it set up a little bit lower so you can do around the hip easier. Okay? You can get down here nice and easy, but once you get to the hip, it's very hard to get too high.
Because they're so low down, Trent, would you ever do this seated?
Oh, you can, yeah, if you wanted to bring in the stool and just sit down, I wouldn't have a problem with that. Yeah. And you see that QL get nice and red just from those cross fibre frictions there. Okay, I'm not going exceptionally heavy, but I'm going nice and firm. Okay? But we can see that line of tension coming in there, can't we? Alright? Quite dark through there. So we'll come in, that's my trigger point working here.
Okay, light trigger point therapy, press and hold, pain level 5 to 6 along edge of QL.
So we don't want to put them through too much pain. So yeah, try and get it at a 5 or a 6. What's that for you at the moment? A 3?
Yeah.
Okay, then we'll go in a bit deeper. It's fine. She's okay. As long as she doesn't go into labour, we're happy. I don't think this client's going to have that happen. So just working to their pain threshold there. If you want to work in with both thumbs, you can. You're not normally working too heavy, so it's pretty easy work. Okay? So when you normally come, when you're standing up, you actually stand. When they're laying face down, you do your QL release. You normally come out over it and then sink back in. So all we've got to do from here is just come across ES and just push down. So when you're standing behind it, it's very, very easy to do it. Okay? Points over sacrum.
If late in labour, 34 weeks.
Just read the collar.
Oh, okay. Alternate pressing with circular thumb needing to sacral foramen.
Yep, so the sacral holes. Remember these were the end of pregnancy. These are the ones that theoretically can help us induce labour. Okay? So we've already worked through QL, we found the top of the iliac crest, so we're just getting into the sacral foramen here. So pressure in there, a bit of circular friction. Of course, yeah, I can't turn and do these. Alright. Feel alright? A little bit tender? There. Alright, so you'll actually feel, when you come across the iliac crest, you feel the top of the sacrum, the bone will drop away a fair bit. Okay, and as you first come down, you'll feel a depression, and that'll be the first sacral hole, sacral foramen. Then you just work down from there, just slide out of one and you slide into the next. If you lose it at the third or the fourth, that's fine. Okay, as long as you get the first couple at least. Okay? Hip. Yes? Oh, hang on. Skip there. Oh, yeah, yeah. Triple. Across the top of the hips. So we're going to do palm kneading, you can do forearm, you can do knuckles, whatever we want basically. Across the top of the glutes here. We're going to get to around the top of the greatest trochanter when they're laying, when we're doing side leg. Okay, as long as their undies are going to move enough for us. So we want to get around the top of the greatest trochanter now, so get through the top layers of the muscle. We'll get the bottom layers of the muscle later. Okay, so working through here, palm heels. Chisel frictions. Following along underneath the iliac crest. This up to you can see. Do the forearm across there. How's that all feeling? Tender. Yeah, these areas that probably will be quite tender. Still got some working with the forearm straight across the top underneath the iliac crest. It is a hard massage to see. I can't really open it up anymore because otherwise I'm dancing around. I'm not showing you where I'd actually stand. If I'm doing it all like that, you'll stand there doing the massage like this, and then I'll go no. Okay, so you make sure you're right behind them, leaning across. If they get any nasty spots there, you can just sink into them there with the elbow. Just sit. Okay, don't try and drill through them too hard. And that's basically all you need to do through there is just do some frictions working across the hip and do any tender points, particularly along the side of the sacrum here that you get for piriformis, like we've got a nice little one in there. And we can just sit on that tender spot for 30 seconds to a minute, let it relax off, and then move on. Okay? Yep.
And is it true the piriformis gets tight when they've actually got sciatica?
Piriformis, of course, sciatica, yes. Just one of your hand tells you. Yep. Alright, so drape the leg now.